Welcome to Desert Living, where we connect you with everything that makes the Coachella Valley a wonderful place to live. Desert Living starts now. Here's Brian Gallo.
Now, although they are not common, a kidney or bladder stone can happen to anyone. That being said, it's important to know what these stones are and what they can do. Dr. Tanagho of Walsh Urology is here with me right now to teach us more. How are you, Doc?
I'm doing well. How are you?
I'm well. Nice to see you.
Good to see you. Thanks for having us.
Yeah. So is it true? Is this a rare thing, or is it fairly uncommon? Or?
Oh, no. Stones are extremely common, especially in a desert environment where people can fall behind on their fluids, and dehydration can predispose to stones.
Okay. So with that being said, what are the differences between kidney and bladder stones?
So bladder stones form in the bladder when the urine can't pass, when the bladder fails to push the urine, usually because of a large obstructive prostate in men. The urine sediments can coalesce to form stones. Kidney stones form in the kidney and usually have to do with diet and metabolic abnormalities. There's different types of kidney stones. My patients get a 24-hour urine study and some blood work, and we can over 90% of the time identify specific risk factors that predispose each individual to his or her kidney stones. And based on the specific type of stones they have, we can tailor a treatment plan and a prevention plan to help them prevent their stones.
But a lot of it is diet and hydration.
Absolutely.
Or dehydration.
Absolutely, and especially a high salt diet is a high risk factor for stones. A high animal protein diet, so meat, poultry, fish, increases the risk for stones. We talked about low fluid volume.
Yeah.
The goal is to have 2.5 liters of urine output a day, and not many of us achieve that, especially in the desert. There's certain types of urinary tract infections that can predispose to kidney stones, and certain genetic abnormalities that can predispose to kidney stones. Also, certain diets that have high oxalate content, such as broccoli, spinach.
Oh, we love broccoli and spinach.
Yeah, that's what my patients say. Tomatoes, nuts. So
that's nuts.
Yeah.
All right, tell me this. What are some symptoms for those of us who don't know?
So if you have colicky, flank pain, or groin pain, nausea or vomiting, if it's associated with an infection, you can have fevers and chills. As the stone is passing, it can cause bleeding, so you can see blood in the urine.
Tell me a little bit more about treatment.
So treatment, there's different types of treatment. The one that I recommend highly to my patients is placing a camera through the urethra into the bladder, up the ureter, and into the kidney, seeing the stone under direct vision and using laser energy to break up the stone. And the reason I prefer this treatment is that you're there seeing the stone under direct vision, so you can control how small the fragments become before you leave. Also, laser has such high power that you can break up any type of stone with this treatment. There are other options.
This is obviously new technology, right?
It's being refined all the time, and the equipment is smaller and can fit in nicely into the ureter, better visualization, so it's an evolution. Other options include shockwave lithotripsy, which involves shocking the stones from the skin without going into the body. It's less invasive, but it has lower clearance because it's not as powerful as the laser energy. Also, if you're obese, that the skin to stone distance is long, so the success rate is lower. Also, the stones have to be visible on X-ray to be able to shock them because you're guided by X-ray, and 30% of stones are not visible on X-ray. So it's a less invasive but more limited option. There's also percutaneous nephrolithotomy, which is making a hole through the skin and dilating the kidney and accessing the stone directly through the skin. That's a much more invasive option, but it's useful for very large stones, maybe over 2 centimeters, because we're able to place larger instruments and really break up the stone and evacuate the fragments out.
So that's the extreme case scenario.
For very large stones,
But
yes.
there's options for everyone.
Correct.
All right. Well, you can find Walsh Urology in Rancho Mirage. Schedule an appointment or a consultation by just giving them a call, or check out their website, walshurology.com. A big thanks to Dr. Tanagho for being here. I learned something. I hope you did as well. Thanks, buddy.
Thanks again for having me.
Yes, of course. We'll see you after the break, everyone.